Something I've learned in walking alongside so many bereaved families is that as health and social care professionals, we become part of a family's forever story. Often I was asked to facilitate conversations with multidisciplinary team members around bereavement care, and I was really curious that they would often say to me, "But we don't do bereavement care." And I would suggest to them that the minute you meet a family, often at the point where a child is diagnosed with what we know is going to be a terminal illness, you become part of that family story. The way you speak to them, your tone, your language, your actions, your mannerisms, the things you do and the things you don't do, they become part of a family's memory. And so it's so critical that we really pay attention to who we are and to be our best person, fueled with love and care and compassion, to ensure that that family's memory after their child dies is one of security and trust and of no regrets.
Eddie had been incredibly unwell. He'd been on an enormous amount of tubes and all sorts of devices going in and out of his body. He was incredibly sick. We weren't quite sure if he was going to make it at that time. And he hadn't had a bath. The nurses had been really busy, and it was Easter Sunday. They were very short-staffed this Easter Sunday, but this one nurse, I will going to get emotional in a minute. This one nurse, whose name I will never forget, her name was Emma, and she helped me bath him and put some fresh clothes on him and wash his hair, and I could sit in the chair and hold him. It was really important because it gave me some time to hold him and be near him and to create a memory that I will never forget.